everyone. Thank you for joining us tonight. Just a note to everyone in attendance that we are recording this session tonight, this conversation with Lisa, and we will be saving time at the end to answer questions. So you can submit any of your questions through the Q&A icon, and we will try and get to as many as we can at the end of the presentation. So Lisa, I'll hand it over to you.
Thank you, Kimberly, and thank you everyone for being here tonight. I'm Lisa LaFontaine, the CEO of the Humane Rescue Alliance, and I have my big headphones on because I have 3 dogs, 2 of whom I've adopted in the last month, and they're all clamoring for my attention, but I think this is probably a good crowd to have that problem with. I'm going to share my screen, and let me just tell you what I'm going to do tonight. I'm going to walk through the results of our organization over the last year. And then I'm going to pause and I'm going to put that into the context of the broader world of animal welfare across the country, because we're seeing some trends here that are being seen from coast to coast. And then I want to take a moment to talk about the future, starting with next year and some of the things that we have in store and that we're already working on for 2023. And I'm going to close with a few words about our longer term vision, which has shifted a little bit with the effects of the last few years. And then finally, we'll save some time at the end for your questions. So without further ado, let me get started. So as you can see, we had some pretty amazing results in 2022. And I should say that these statistics are organization-wide, meaning that it includes all of the work that we've done at the Humane Rescue Alliance in DC and all of the work that we've done at St. Hubert's in northern New Jersey. And altogether, we've saved the lives of nearly 95% of the animals who've come through our doors. And that's just a phenomenal achievement of our team. Nearly 9,000 animals were adopted or reunited with their families if they had gotten lost. And I think one of the really exciting things that I see as a real source of optimism for the future is that we had almost 3,200 animals living in foster homes. And that's a tremendous growth since before the pandemic. And one of the silver linings of those pandemic years is that so many people joined us as a foster. And, you know, I foster myself, and I know how challenging it is and how rewarding it is and how attached you get to the animals. And so I really have a special place in my heart for the people that take our mission into their homes this way. And the other folks that have really propelled our success in these last few years have been our volunteers. Altogether, they've given us over 42,000 hours of time. And if you calculate that at minimum wage, and they're certainly tremendously valuable, but we've got to start somewhere. That's $1.5 million in time that they're giving us. Our medical team performed over 8,000 surgeries. And our behavior staff did 8,700 individual enrichment sessions with shelter animals. And if you think about how the animals come to us, oftentimes they're frightened because they've been separated from their families. They might have been abused. They might not have had a lot of socialization in their early months. Many of them need this kind of support in order to succeed in adoptive homes. And so the work of our top-notch behavior team has been instrumental in helping us get those animals ready for adoption and prepare them to succeed. Our field services officers responded to 19,500 calls for assistance, and that number goes up steadily each year. And I think it's because people see our officers in the community, they see that they're helpful, that they're supportive, and there's a real word of mouth effect that goes on. And so we are projecting that number of calls is going to go up in the years ahead. And then I want to give a special shout out to our neonatal kitten nursery, which we call the Kitten NICU. And it is exactly what it sounds like. It's exactly like a human NICU. These kittens come to us, sometimes they're hours old. They are the most vulnerable of the vulnerable, and they're really hanging on by a thread in most cases. And we have the room set up with incubators and bottle and syringe feeding. And that NICU saved the lives of 99% of the cats who came in. So that's a tremendous achievement. I also want to take a look at what happened outside of our doors, because we are really focused on getting deeply into the community to address issues before they become problems and to support pet owners so that they can have happy, healthy, joyful relations with their pets. So I think what I'll start with is that access to pet food has become more of a challenge as people struggle economically. And we've got partners who regularly donate truckloads of pet food, 285,000 pounds of donated pet food last year. And we needed every pound of that food because we gave out nearly 340,000 pet meals to people in the community who needed a hand. And if you can imagine, 95% of people that have a pet say that they consider them a member of the family. And so if you don't have enough resources, if you don't have enough food, a lot of people would make a choice to feed their pet before themselves. And so giving out these pet meals helps to make sure that people are being nourished as well. Our way station, which I'll talk a little bit more about, is a transport program that moves animals from shelters where there is high overpopulation, lack of resources, often very high euthanasia rates. And we move those animals through a transport program of 80 different partners. So there are about 55 sending shelters. The balance are receiving shelters. And we move those animals, as we say, from crisis to care. And they go into communities where there are adopters waiting for them with open arms. And then finally, we have a program called Safe Haven, which is a specialized short-term foster program for people who are experiencing housing crisis, whether it's homelessness, whether it's domestic violence. It's people that need to leave their homes in a hurry and need a place for their animals to be safe while they find the next place for themselves to live. And so we took care of 66 animals for 66 families through our Safe Haven program last year. And I just want to go deeper on some of these highlights. Our pet support team, which was formed in early 2022, is the first point of contact for people who are calling in distress, people who are calling with a crisis around their pets. And oftentimes they're navigating economic or other systemic challenges, which actually put the relationship with their pet in jeopardy. And those folks that call us, they don't want to give up their pets. And so when we get a call like that, we look to all of the services in our organization to see what we can do to help preserve that pet relationship. And last year, we were able to keep 642 animals with families in homes where they were secure, with people who loved them. And every one of those animals was on their way to the shelter. And so if you just think about what that means, that's 642 animals that didn't come in. Our shelters and cages are used, we're full to capacity at all times. So that meant we could keep nearly 650 kennels available for animals who had to come in. And so our real focus going forward is to see how far can we push that number? How many more animals can we keep with their families? And it's not just the shelter availability. The thought of losing a pet is deeply traumatic to people. And knowing that there is a reliable agency like ours and compassionate people like our team who are willing to help really helps ease the trauma of a tough time. And so we really feel like we're making families stronger. We're not just preserving the families, but we're making them stronger each time that we can keep an animal in their home. I mentioned that our field services team is busier than ever. And if you consider both the animal control officers and the humane law enforcement officers, they responded to over 21,300 calls last year. And our law enforcement team investigated nearly 2,100 reports of cruelty and neglect. And one of the things that they saw is an uptick in neglect cases that started with a lack of access to care. It might have been difficulty in getting food, malnourishment. It might have been not being able to get a veterinary appointment or establish a relationship with a vet. It might be someone trying to treat an animal themselves because they couldn't pay for a vet visit. And, that is not traditional cruelty. That is people who are desperate. And so looking at the stories and the data coming in from our field services team has led us to create a field veterinary program, which I'll talk about a little bit later. And then very importantly, we don't just care for cats and dogs and small animals. We are in DC, the animal control facility for the nation's capital. And that means that we see animals of all species. And all you have to do is fly above the city and see the green space to know how many wild animals live in very close proximity to us. And this year, our wildlife program manager, after 3 years of studying an apprenticeship, was licensed as a wildlife rehabilitator. And what that means is that we'll have safe live outcomes for wild animals who before this year might not have had that hope. And so we're just thrilled that she put in the time and she was dedicated enough to get that certification. As I mentioned, our way station, which is based at St. Hubert's in northern New Jersey, moves animals from shelters where they likely face euthanasia into communities where there are many homes waiting to adopt them. And the movement of the animals is just a part of that equation. We also develop really deep, meaningful relationships with our way station partners. And part of what that means is taking a portion of the adoption donation that we collect at the point of adoption and reinvesting it in the sending community in whatever form they need, whether it's spay neuter or supplies or training. We also send our expert teams to some of those sending shelters to train them in basic shelter behavior, medical protocols. And so we view this not only as saving the lives of the animals, but in helping to build capacity in our shelter partners. And this summer, in August, we welcomed our 20,000th animal from a shelter in Louisiana. And you can see that Sweetie Johnson is in the arms of Andrew Heyer. Andrew is one of the managers of the way station, and he personally gives a hug and a reassuring word to every single animal as they come out of their travel kennel. And Sweetie probably had no idea why there was a cake and lots of excitement and singing when she came. But what she does know is she's now part of a loving family, and it's because of the way station. And then finally, we've showed up in our communities in ways that we could only have dreamed of a few years ago. And that is thanks to you, all of the people that support us, that donate to us, that give us supplies. We were able to take the gifts that you give and serve 10,011 animals, many of whom have never had veterinary care before in their lives. We administered 12,110 essential vaccines. And if you think about it, without us, without you, those animals wouldn't have had veterinary care. They wouldn't have gotten those vaccines. And beyond that, as you can see, this is a very typical view of getting ready to go to one of our pet pantries, and we give out not just vaccines, and we do more than medical care. We also give out food and toys and other supplies. And this is really life-changing for people. And it gets out into the community. It allows us to see what the needs are and really establish a dialogue with our neighbors. And out of the over 20,000 animals we served, I just want to pull out a few stories. Darwin, who you see is in the upper middle, this was a heartbreaking case. He was actually thrown out of a high-rise apartment building in DC. And when our officers got to him, he was unconscious. He was covered in bugs. He was we weren't sure he was alive at first. And when we rushed him to the hospital, we found that he had many injuries from being thrown out the window, but he also had pneumonia. And so it was a real touch and go situation for him. And we're very lucky that Friendship Hospital for Animals was able to care for him and give him that intensive treatment. A foster home took him in, and that foster family actually fell in love with him and ended up adopting Darwin, and he is happy and robust and healthy. And again, that's thanks to you. Mango, who's down on the bottom in the middle, came in as a kitten in our neonatal kitten unit. She was found in a storm drain when she was really tiny. And again, she was on the verge of death. She had all kinds of illnesses and injuries, and she lived at the neonatal, the NICU for 5 weeks, being lovingly and carefully nursed by our team. And as you can see, she also healed and thrived, and she is now in a loving home. And then I want to highlight Elvis. Elvis is in the top middle, and he's being fitted for a wheelchair. And Elvis had a spinal injury that cost him the use of his back legs. And when his family brought him to the vet, they were told that there was an operation that could potentially save him. It could also potentially kill him. And it would have been many, many thousands of dollars. And the family, number one, they didn't want to put his life at risk, but they couldn't have paid for the surgery, even if there had been a better prognosis. And so desperately, they called the Humane Rescue Alliance, and they wanted a second opinion. And Elvis came to our medical center, and our vets took a look at him and realized that he could actually live perfectly well with a wheelchair, as long as he was supported, as long as it was fitted properly. And the family, it was too much for them to buy that wheelchair. And so we bought the chair for Elvis. And when it arrived, he came back, and there he is getting fitted for the wheelchair. And he literally ran out of our medical center in his little wheelchair, and he is sprinting around happily in his home. And if you think about it, each animal that comes in to our care costs a minimum of $450 to shelter and care for. And that's on the low end. That's before we get into extensive medical or behavior treatment. And so for $213, we were able to buy Elvis a wheelchair that not only costs less than sheltering him and rehoming him would have, but best of all, kept him with the only family that he had ever known. And so keeping pets with their people is a theme that you're going to hear in the months and years ahead from us. So there's something happening nationwide in animal welfare that we are really trying to understand and get a handle on. And if you've read local media, if you follow us on social media, if you visit our facilities, you will see that we are tremendously full of dogs. We're not actually tremendously full of cats. As a matter of fact, last weekend, we only had a handful of cats on the adoption floor. And that's in large part due to the success of our spay neuter and our trap neuter return programs over many years. But dogs, and especially large dogs, that's a different story altogether. And I just want to dig into this a little bit more, because it's going to require creativity. It's going to require innovation. It's going to require funding. It's going to require volunteers, because the ground has shifted underneath us, and we're going to have to do our work in very different ways than we did in the past. And so the data I'm going to highlight for you comes from a national shelter database called Shelter Animals Count. They published their annual report a couple of weeks ago. And so the data in their annual report looks at trends from 2019, just before the pandemic, and really digs deeply into the year 2022. And so because Shelter Animals Count only used complete data in their annual report, this represents 1,030 animal welfare organizations, and it counts about 1.56 million animals for 2022. And so here are the things that we're seeing at the national level. We're seeing, most alarmingly, that the intake of animals was 4% higher than the number of animals who left. And so it's really hard to do the work. It's really hard to keep our lives saved numbers up in that, facing those kind of challenges. And we really count on adoptions and other kinds of live outcomes to keep up with intake. And so if intake is higher, that's a big, big problem for us. So as intake was up 4%, adoption rates, depending on where you look in the country, either decreased dramatically or decreased slightly. It varies a little bit from region to region, but I think it's fair to say that shelter adoptions have really stagnated in the last couple of years. The other thing that's really deeply concerning is that transports from organizations that are really under-resourced, who face high overpopulation, who face high euthanasia numbers, they rely on transports like our way station to help them keep their heads above waters and to help them save the lives of those animals who deserve that second chance. And so we, through St. Hubert's, were actually one of the few organizations that transported regularly throughout the pandemic. But overall, transfers have dropped. And that's in large part because the intake facilities, the destination shelters, are also seeing longer lengths of stay, flatter adoptions. And so they haven't been able to take as many transport animals. So you can see that this equation across the top is really deeply concerning for those of us managing animal welfare organizations. I mentioned that length of stay is up, and the problem with that is that animals do better if they move through the shelter system more quickly. They are more prone to stress or disease or behavioral deterioration if they stay in the shelter longer. And that is no fault of ours. I mean, we, as you know, we have an amazingly competent, compassionate staff, but the reality is that shelters, even shelters as nice as ours, are institutional living. It's not the same thing as sleeping in a bed or sitting on a couch. And so we're very concerned to see the length of stay ticking upward. Now, owner relinquishment is largely unchanged. As a percentage of intake, it has stayed at about 25%. So that means that stray intake is up quite dramatically. And it's no surprise that in the midst of this environment, all the people doing this work are feeling the stress. Our employees across the nation, volunteers, foster providers, anybody who encounters our organization feels the stress of this changing dynamic. Now, our numbers look a little bit different, and I just want to call your attention to them. Our intake is actually down a little bit, but I'll tell you why our intake is down. If you jump to the last row here, return to owner is a statistic that measures the number of animals who were lost or who escaped from their house or their yard and were reunited with their owners. So you can see that our lost and found team is hitting grand slams. They were able to return nearly 400 more animals to their owners in 2022 than in 2021. And as a matter of fact, they've been so successful that we have now dedicated a staff position just to return to owner. And so if you think back to that figure I gave you earlier, where 642 animals were treated at our medical center and returned to their families, and an additional nearly 400 more were reunited with their owners over 2021, you can see that we kept over 1,000 animals out of the system who otherwise would have been in our doors. And so our intake would have been up if not for those 2 data points. Our adoptions are up a little bit. Our transfer out is down pretty significantly, and that's because our transport partners, primarily in the Northeast, haven't been able to take as many animals in. And as a result, we haven't transferred as many animals in because we didn't have those shelter partners in the North who had availability to receive them. So I'd say that, overall, we've got to keep the focus on what we call intake diversion. That means providing resources or solutions or support or care to animals outside the shelter walls so they can stay with their families. And we've got to figure out new ways of doing adoption and new ways of meeting adopters. So with all of this, I am generally an optimistic person. And even though we're facing challenges, I'm looking at some things that are incredibly encouraging that I think we can capitalize on to make 2023 better than 2022 and the future brighter than all the years behind us. And I think that one of the most encouraging things is the data that we're collecting on the love that people have and the commitment that people have for their animals. As I mentioned to you, between 90 and 90% of people surveyed who have a pet consider them a family member. And that is, that's pretty ripe ground for us to do our work. If people consider animals family, then it's more likely that people are looking for ways to keep their animals, that they're going to prioritize keeping their animals, and that they will be open to working with us on solutions that not only help them, but help the entire community. And that's different. That's different than 15 years ago. So that's really incredibly encouraging. But it also means that with all those people who want an animal, all those people that love their animal, we've got to make sure that everyone who has a pet can keep their pet, and everybody who wants a pet has the ability to acquire a pet. And that means not just looking at the animal challenges in our community. That means linking arms with community service providers that serve people, so that we're coming up with family solutions, neighborhood solutions, community solutions, because most of the problems that cause people to be in distress are the exact same problems that are causing animal family members to be in distress. And so we need family solutions. And so what that says to us strategically is that we need to shift our resources. In the past, most of our resources went into the direct care of animals, sheltering, lost and found, spay and neuter. But we have to look at things a little differently going forward. And so one thing that we are putting more focus into is capacity building, whether that means making sure we have a staff that is growing and more capable and more skilled month by month, year by year. It means making sure that we are in the community providing education and learning opportunities for people to understand animals, care for animals. And it means working with our shelter partners to make sure that when we transport an animal from them, we help to make them stronger as a result. And that isn't the case with all transports. If you do transport wrong, you make the sending shelter weaker. And I and our team are deeply committed to making the sending shelter stronger. And so that requires really focused capacity building. And then finally, prevention needs to be a bigger piece of what we do, keeping animals in homes, keeping them safe and healthy where they are, keeping them with the people who are already bonded to them. This is critical. And it's a whole new way of doing our work. And I really can't underestimate that while we want to do it, we don't have all the answers yet. And it's going to take some pretty sophisticated change management for us as an organization to essentially re-engineer how we've been doing things and how we've delivered programs and services. So I'll give you just a few highlights, and this is, this is just literally a handful of our strategic goals, but I wanted to highlight for you some of our either newest or what I think will be most impactful areas of focus. So in that prevention column, we will be establishing a pet call center to help people solve urgent and emergent problems. And this pet help center or call center is intended to give people answers to easier challenges, less complex challenges, things that they can solve quickly, things that they can, a call center that they can access all of the time. And that will take a lot of the work off of our pet support professionals, who then will be positioned to deal with slightly more complex problems. So we're in the process of building that call center, which will have a virtual component through our website. And related to that, we'll be hiring a veterinary social worker, because as I mentioned, animal problems are usually family problems. Animal challenges are almost always a struggle that the family is having. And so that requires a more complex intervention, and it requires working with the organizations that serve people. And so we'll be looking for a social worker who can really handle that kind of top of the pyramid, where there are fewer families in distress, but the distress they're in is more complicated and is going to take a little bit more unwinding in order to solve. And then finally, we're going to launch our field veterinary program. And so we have hired a team, a veterinarian and a veterinary technician, who are on call with our field services officers and who deploy when they hear of an animal who might be needing urgent veterinary care, but the family can't provide it, who maybe they just need a visit and an assessment or a triage to see if they have to come in. And the first 3 days of this team being in place, they kept 15 animals in their homes. So if you think about that, day over day, month over month, throughout the year, on 3 days, our team of 2 were able to keep 15 animals out of the shelter facility and in their families, and treat them for whatever was ailing them. And so multiply that out, and you can see that we will hopefully keep dozens upon dozens, if not hundreds of animals in their homes through this intervention. I had mentioned that adoptions are flat with us and across the country, and we don't know exactly what's happening with this. I was at a supply and demand summit earlier this summer, or last summer, that brought together a half dozen or so leaders of animal welfare organizations like HRA, some of the national animal welfare groups, the AKC, the CEO of Petland, which is the largest pet store conglomerate in the country. And as we shared all of our data, we realized that all of us saw a dip in acquisition. And so we also saw data that acquisition of dogs is going up. And so what that means is that more people are getting dogs, but they're not getting them from shelters. They're not getting them at Petco or PetSmart. They're not getting them at pet stores. They're not getting them through the AKC, through breeders. So where are they getting them? That's the nut we have to crack. We have to understand, what is this new provider of dogs, and what is the condition of those dogs? How are people meeting them? My concern is that this is a commoditization of dogs, and it's probably happening online, which is a completely unregulated space, and it's most likely being done without the wraparound support programs that we and other humane societies provide to make sure that adoption isn't the last, or the day of acquiring the dog is not the last day that we interact with the new pet owner. And I'm really concerned about this. We all are concerned about this because we don't know how those animals are being vetted, what kind of medical care they have, what kind of physical and emotional condition they're in. We don't know what kind of counseling is being done. We don't know what kind of follow-up is being provided. And, if we don't figure this out, not only will a lot of animals lose their lives because the shelter system is clogged up, but I think even worse, a lot of those animals will probably be coming to us in a couple of years, because my guess is that these internet providers are not providing a lot of the services that I've just mentioned. So we've got to figure this out, and quickly. And so we've got a team that's looking at all the ways that we can effectively compete with online dog acquisition, but do it in a way that ensures the welfare of the dogs, that does good matchmaking, and that provides a lifetime of support for those pet owners. And we also would like and intend to grow our foster program. At any given time, about 55% of the animals in our care are in community foster homes. And that's great, because they're sleeping in those beds, they're sitting on the couch, they're being socialized. They've got an advocate who really knows them and can talk about their personalities and their lovable quirks, and really do matchmaking in partnership with us. And so we love the foster program. And the question we're asking ourselves is, who actually needs to be in the shelter? And if they don't need to be in the shelter, how can we build a foster program that allows them to be sheltered in community foster homes and adopted from those homes? And then I talked about capacity building as being important. We have launched the Crocker Institute, which is a workforce development program to create career paths in animal care and animal welfare for well, there's my dog loves that program, for citizens of our community. And Saloni Crocker was a wonderful partner of mine and of ours. She was an animal advocate in this community, who was deeply committed to our cause, but deeply committed to making sure that young people had opportunities to have rewarding, successful professions. And she passed away. She was a board member and passed away in 2017. And together with her family, we came up with the idea of a workforce development institute that would uplift the lives of animals and make sure that a community is caring for animals more safely and more lovingly and more competently, but also provides careers, sometimes starting at 50 or 60,000 a year, for vulnerable people in our community. And so in January, we welcomed Lawrence Minnis as the director of the Crocker Institute. And just as an aside, I hope you'll have the opportunity to meet Lawrence. I met him back in 2008 when he was a wounded warrior at Walter Reed, participating in our dog tags program. And our dog tags program was, in fact, a workforce development program, where we worked from our Georgia Ave animal shelter with soldiers who were just coming through their therapy at Walter Reed to give them career opportunities, knowing that their wartime injuries prevented them from returning to active service. And so Lawrence was the first graduate of the program, and he is now paying it forward. He has spent his life since then becoming an expert in animal welfare. He's getting his doctorate in animal behavior, and he is the driver of this program. And I can't think of a better, more safer pair of hands for the Crocker Institute to be in. So we'll probably have a town hall just to talk about this program. And then finally, we're looking at how can we better support our sending shelters to help them get out of the desperate cycle of overpopulation and euthanasia. And so we will be offering support, services, supplies, consultation to our sending shelter partners, but we're also adopting and piloting a hub and spokes model where we work with another well-resourced animal welfare partner in areas that are very close to communities where overpopulation and euthanasia are through the roof. And our first partner that we're working with in this hub and spoke model is Operation Kindness, located just outside of Dallas, Texas, which is one of the toughest places to be an animal. And our team was at Operation Kindness last week, and we're really looking at how do we create a hub and spoke model that allows us to work with an organization on the ground to move animals and to penetrate more deeply into mostly rural areas where animals are losing their lives completely unnecessarily. So I'm really excited to talk more about that with you in the months and years to come. So I'll let you just take a look at our guiding principles and what really informs our work and inspires our work going forward. And we believe that pet ownership should not be a privilege, that everybody should have the opportunity to have and keep their pet, that we should reunite lost pets more quickly with their families and more effectively with their families, and keep more animals in their homes. And I've talked about all of these other things, but you know, this is really the foundation of the work of HRA going forward. And we're going to be using a networked approach to our work. You know, in the old days, we had shelters and we expected people to come to the shelters to get services, but we're missing out on a lot by doing that. We are inaccessible to a lot of people who don't have transportation. We are in a different part of the city than many of our people that need us the most in Washington, D.C. And, you know, if you don't have transportation, it's pretty hard to access us right now. And so what we'll be looking at over the next 5 years is a place-based strategy that takes all of these things into account, that looks at locating animal health care in facilities, in buildings with human health care, so that the whole family can come in and get their shots and their tests. We'll be working with neighborhood help centers and really have like mini HRAs out in the community. We'll continue to have lots of community outreach events. Last year, we did many vaccine clinics in the neighborhoods of DC, and our veterinary team will become a mobile medical unit with a surgical suite that can actually go in the community with X-ray machines and the ability to do more in-depth treatment and surgery. We're looking at transportation services, either a dedicated core of volunteers or partnering with Lyft and Uber to get people rides to access us. I talked a little bit about the pet call center and the virtual HRA. And then our facilities will not be just shelter facilities, but they will be places where we offer other kinds of services and where we generate earned income. And so many of you know that we've bought property at M Street, which is in a very vibrant neighborhood of Washington, D.C. And it's in the Capitol Riverfront District, not far from the Capitol, just across the Anacostia River from where the most people need our services. And so that we're going to be developing that facility with a partner in order to have programs and services and earned income opportunities that capture some of the money that people are already spending on pets in the community and put it toward our philanthropic work. And so this is just another way of looking at our model, which puts animals and people and community at the center, which is deeply rooted in the community, which makes use of not only community experts, but community solutions. You know, the thing that I think about every day is that there are animals who are not coming into us because something went right. And that something that went right might not have anything to do with us. But what we can do as the animal welfare leader is make sure that we understand and scale and spread those successes so that more and more families have the opportunity to have the love and laughter and joy of a pet in their lives. So with that, I'm gonna stop, and I'm gonna ask Kimberly if we have any questions.
Thank you, Lisa. If there's any questions we don't get to tonight, just a reminder that we will get to them later. We'll reach out separately. But we'll start with one of our first questions, which is, what would you say to other shelters during this unstable time to keep them motivated when their shelters are at capacity and their resources are limited?
Well, not to date myself, but I've been working in humane societies since 2001. I was a volunteer in a humane society for 4 years before that. And so I remember that when I started in animal welfare in 1997, almost every shelter in the entire country was euthanizing for space and didn't have any of the programs that we talk about today. And so I saw what that was like. And I know how painful and challenging that was. And I know that there were brilliant, caring, wonderful people, many of whom are still in this field, many of whom are you who've been supporting our organizations, who are looking to solve those problems. And, I think about Hurricane Katrina, which was a devastating event for people and animals, but where a real bright spot where the entire community came together. And by the community, I mean the entire nation came together to make sure animals didn't fall between the cracks. I think about the day that I came to Washington Humane Society when the live release rate here was 28%. And I just showed you a slide. It's 95% today. It was a pretty desperate time in 2007 at Washington Humane Society. And I think about the pandemic. So we've seen some really tough times, tougher than what I've just described to you. I mean, a global pandemic, a horrible hurricane, a movement that was trying to do its work with people who didn't even want to come to our facilities. Those are real challenges. And I think that the challenges we have now are vexing and will require creativity and require some grit and innovation. But we can do this just as we have advanced so much as a profession over the last couple of decades. And so I think that's what I would tell people is just look at where we were not that long ago. We can see what's needed. We know what the challenges are. We're working with, we're working in a country and in a world where people value animals as deeply as they value some of their human relationships. And so we have a lot of partners to work with.
Thank you, Lisa. There's another question asking why we think there's so many dogs versus all of the other animals that might come into our shelter that we have struggles with placing and longer term animals in our care.
Yeah, I think the biggest challenge is that we had to do everything virtually during the pandemic, and people got used to getting their groceries virtually, their teleservices for their own healthcare. We didn't leave our houses. Well, that's not true. There were a lot of people, including many of our staff, who were doing essential work, but there were many people who didn't leave their homes and who got used to getting everything dropped at their doorstep, including dogs and cats. And I think what has happened is that, I don't know who exactly these parties are, so I really can't be specific about it, but I think there are people that saw all the articles that you saw about people adopting in large numbers and people wanting their pets. And they created a business model around it, around getting animals to people virtually. And I think that some of these providers are probably pretty close to animal traffickers who are doing it to make money. And that is never good for the animals when you're doing it to make money. And so we've got a competitor that we didn't have a few years ago, a competitor who is more convenient than we are. And that is our challenge, is to figure out what we do and how we change our work in the face of that competitor, but in a way that preserves the integrity of the work we've been doing so far around animal welfare, matchmaking, and supportive services.
So when we're thinking about doing a lot of our work towards shifting into prevention programs to really be sort of acting in the face and in anticipation of climbing intake numbers that we're seeing nationally. What challenges do you see, or what are you anticipating? Like, for example, the field vet becoming more in demand than what we can meet.
I know the family of supporters that we have around us, and I know that many of our supporters are on this call, and that usually when we share a problem and a solution and ask for your help, you lean in and help us. And so I think that if the team of vets that we have isn't enough, and we can make a business case why we need more vets, and that it's actually less expensive to keep animals with their families than it is to shelter and rehome them, then I'm optimistic that we can find people, foundations, animal welfare organizations who will support that work. But I think the key, and one of the things that we've done this year, and I want to give a shout out to Maddie's Fund for this because they've made the work possible, is we've created a data team to do really sophisticated analytics and surveys so that we can make a better business case for our donors and supporters. So I think that the solutions are out there, the people are out there. We've just got to do the good work of understanding and diagnosing the problem, and making a case for the solution that we've come up with. But I'll tell you, I can make a very wide sweeping generalization. It is generally less expensive, less resource intensive to keep an animal with the family who already loves her.
So then what are you most looking forward to in 2023, Lisa?
Oh, wow. Well, I have to say we have the most amazing people to work with. Our staff, our volunteers, our foster providers are incredibly inspiring. I have never worked with a team this amazing in my life, and it's a privilege to do this work every day. I think that's why I'm optimistic, because I have seen the depth of the skill and commitment and dedication of our team. And I come out of work at night, and I like to be there late on the day. I'd like to be there until 6:37 at night. And when I come out, our volunteers are there walking the dogs with great dedication, no matter what the weather. So I think what I'm looking forward to is getting to solve these challenges with some of the most amazing people that I know. And the happiness in our lobby or our parking lot when people can come to a wellness clinic at our parking lot, or at one of our community outreach events when people come pick up their animal from our medical center. Just the joy of that reunion never gets old. It's inspiring every single time it happens.
Well, thank you so much, Lisa. We're at close to the end of our time. So we just wanted to remind everyone that the conversation will be available on our YouTube tomorrow, but also everyone will get a link to their inbox. And, we're just so thankful that you could join us. And Lisa, thank you so much for taking us through.
Thank you. And I just want to thank the people on this call. You're the reason we can do this. So I hope that you take some satisfaction and even pride in the work that you've made possible. And the commitment that I and our entire team can make is that we will put your gifts to good use to help even more animals and people in the years ahead. So thank you.